signs that your cholesterol might be high without a blood test. High cholesterol is in majority of the cases a silent condition, meaning most people do not get the symptoms until it is very serious. Your eyes can tell if you have high cholesterol levels. Sometimes patients with high cholesterol level develop a gray or white ring around the colored part of your eye. So friends, before we get into this topic, it is important to know that high cholesterol is in majority of the cases a silent condition, meaning most people do not get the symptoms until it is very serious. So therefore, you should not depend on these signs to diagnose whether or not you have high cholesterol. However, there are some subtle signs that can be an indirect clue of you having high cholesterol levels. So let's talk about them. Number 1. Xanthelasmas. So, xanthelasmas are visible fatty deposits in the skin. You can have a yellowish looking lump around your eyes, around your elbows, your knees, or your ankles. And these are basically cholesterol deposit under the skin. And therefore, these can be obvious in people who have very high cholesterol levels, but are not always the case. Number 2. Your eyes can tell if you have high cholesterol levels. Sometimes patients with high cholesterol level develop a gray or white ring around the colored part of your eye. Now, in majority of the cases, this is an age-related condition called arcus senilis. However, if this appears in very young people that are 20, 30, 40 years old, then it may be an indication of high cholesterol levels. Number 3, chest pain. If you are a young person less than 50 years old and you are having chest pains, then it could be an indirect suggestion or a subtle sign that you have too much cholesterol, which has caused blockages in your blood vessels, and it may be time to get it checked. Number 4, pain in the legs when walking. When you walk, you get pain in your calves, and when you stop walking, the pain goes away after a few minutes. And this pain is predictable, meaning every time you walk, you get this pain in the legs, which goes away when you stop. This could be an indirect sign that you have high cholesterol levels, and these have caused blockages in the blood vessels of your legs. This pain is called claudication, and again, it could mean that your cholesterol levels are very high. So it is time to get them checked. Number 5, if you have a family history of either heart attacks at a young age, or you have a family history of high cholesterol levels, then it is also a very strong predictor that you could also have the genes that are causing high cholesterol levels. So in that case, even without any signs or symptoms, you must get your blood test to make sure that your cholesterol is well controlled and does not need to be treated. And again, friends, as I mentioned, even though some people with high cholesterol can have these signs, do not depend on these, because only a minority of patients have these signs. And instead, the best and the only way to know if your cholesterol is high is a blood test. I hope this information was helpful. And if you have any other questions like this for me, please feel free to comment. And do not forget to like and subscribe to our channel. Thank you.